On September 15th, 1998, my parents were blessed with a baby girl. At around the age of 4 months old, that baby broke out in a rash, had persistent fever, and was in constant pain. At the age of 8 months old, that baby was officially diagnosed with juvenile rheumatoid arthritis, now known as juvenile idiopathic arthritis, or JIA. That baby is me. At around the ages of 12 and 6, my disease was deemed chronic, and at the age of 16, my disease developed into adult idiopathic arthritis, meaning it was going to follow me into my adulthood. Now, at the age of 23, I'm still dealing with this disease today. 1 in every 1,000 children are diagnosed with some form of autoimmune disease, and the CDC states that 300,000 children are directly affected by juvenile idiopathic arthritis, and 58.5 million adults are diagnosed with idiopathic arthritis at some point in their lives. Understanding what JIA is and how it affects someone's life is going to help you better understand what that individual is going through and expand your knowledge on chronic illnesses and diseases. First, it's important to recognize idiopathic arthritis symptoms and how it affects an individual directly. Johns Hopkins states that diagnosis occurs at the age of 6 or younger, and symptoms must be persistent for 6 or more weeks before the disease is officially diagnosed. Some children who are diagnosed with the disease do outgrow the disease, but in other cases, it does continue. It does continue into adulthood, like my own. Onset symptoms are going to include swelling, stiffness, pain, fever, rash, and swollen lymph nodes. However, once the disease is diagnosed and treatment begins, those symptoms do reduce to swelling, stiffness, and pain, and they do occur occasionally. That's going to vary from individual to individual and how their body is reacting to medications and if they have any triggers of these symptoms. Every individual is going to be affected by the disease differently. So some individuals may feel it in 1 or 2 joints, like maybe their fingers or their knees, while others are going to feel it in all joints in their body, like myself. Unfortunately, I have a case where it does affect all of my joints. Next, understanding the causes will expand your knowledge in what the disease is and the extent of the disease. Cedars explains that JIA occurs when one's immune system begins to attack its own cells and tissues. So the white blood cells in your body are not able to identify the difference between healthy cells and sick cells, and it attacks all cells. That is what we call an overactive immune system, and that is the main cause of this disease, or the main effect of this disease. There are no known causes of the disease. However, there are common denominators in the disease. So environmental factors like adverse reactions to vaccines or infections. So if an individual has a mutated gene within their body, once the individual has an infection, their immune system does not stop fighting off the infection even when the infection no longer exists. So it's just fighting its own body, basically. And there are some instances where it has been inherited from family members and parents. Lastly, it's important to know the possible treatments and how to manage the disease. So Mayo Clinic lists a bunch of treatments to the disease, those being non-steroidal anti-inflammatory drugs. So those are going to be Advil, Aleve, Motrin, all of your over-the-counter drugs. There's disease-modifying anti-rheumatic drugs. So those are your black box drugs similar to chemotherapy. However, they are not as severe as chemotherapy because they are given in small doses over a longer period of time. There's biologic agents, which are drugs that I typically take. So that's going to be Enbrel, Orencia, Actemra, Cimzia, etc. Those drugs are going to be TNF blockers, so they're your immunosuppressants. Those are typically given through infusion or at-home shot that is administered once every week or once every other week. And there's also steroids, so your cortisone shots that can be injected directly into the affected joints, or you can ingest a steroid pill that is going to eliminate the inflammation and the pain that you're feeling. So by better understanding what JIA is and how it affects an individual, you're able to better understand what that individual is going through on a day-to-day basis and how JIA affects their lives.